How are you doing? Okay, yes, I'm here to present a case, basically. This is based on the specialty clinic of children diabetes at Karolinska Hospital in Solna, near to Stockholm here. The Diabetes Clinic, which is our recently developed product for child diabetes. It's really about Simon, and Simon is 9-year-old. He is a very active little fellow, a lot of hockey exercise. And hockey and other very energy-consuming sports have a great impact on your diabetes. And Simon had diabetes for about 2 years. And he also tested out our app during the summer, whereby he can sort of forward everything he does and his family is doing to his healthcare team at the hospital. So, by doing this, we have to first, I guess, go back a little bit on the basics. Many people today have talked about this. Healthcare is out of pretty much everything: money, time, and people. And the chronic disease cost in the Swedish situation is about 80–85% of the total budget. Half of that is primary care, pretty much. So if you really want to do something different, you need to work on that blue part. Changing how we care for chronically ill people is becoming more and more important, obviously, due to this. My example here is about child diabetes, but of course you can sort of elaborate in many areas of chronic disease. In terms of the child diabetes in Sweden, you should know that there is about 42 specialty clinics spread out over the country. They treat about 7,000 children in the total population of Sweden, which is approximately 10 million people. Yes, for info. So back to Simon. Now he's back from his hockey practice. He's very hungry. He eats a lot because he consumes a lot of energy. And this, of course, constitutes a daily constant problem of balancing the blood sugar level with a proper amount of insulin. And this he needs help with. So he has a team of parents, close relatives, teachers, hockey trainers around him 24/7, basically, helping him calculate, keep in control, and stay on balance as much as possible. They like to record this, and they need that recorded on paper today because they need to communicate food consumption, insulin doses, and blood sugar levels to their healthcare personnel when and if things go wrong, and they do quite frequently. This is time-consuming for everyone, and it's also stressful for the family, and they basically have this as a full-time job between themselves. So how is this taken care of at the other end, on the receiving end? Well, this is the current situation. This is also pretty generic. It's actually pretty global, we noticed. You have paper-based system, as you heard before. A lot of scribbling, various levels and quality of language in both ends. So when the family has a problem, they have to call in. They have to sort of basically read up these daily charts. This is a daily chart. Could also be a little logbook they have, but it works the same. And in the receiving end at the clinic, they have to scribble this down because you cannot send healthcare data by email in Sweden by law. So they just have to basically dictate everything, take notes, try to write it down, and you can imagine what amount of errors and mistakes and misunderstandings there would be. Now this green sheet, as they call it, now has to go to a doctor that checks it out and maybe recalculate insulin quotas or something like that. Hand it back to the nurse that again calls back to the family and gives a new quota. This is time consuming, for sure. This practice is basically serving two care processes. One is the acute phase, when a child is diagnosed with diabetes. It could be pretty acute, actually. A day or two in ICU, and then 5 to 10 days at the diabetes ward. This is a critical period in time for that family, because they just woken up in their new life as a diabetes family. They have then to get over the shock and then learn the trade of a diabetes family at the same time as they see their kid then come back to normal life. Every day this green sheet is used, and they learn their bedside to do the same. So when they are released from the hospital after 5 to 10 days, they get a stack of these to bring home. Start jotting down all these measurements that they don't have really a clue what they're doing at the initial period. After a couple of months, of course, they get used to it. So this is really the problem. This is why Astrid Lindgren Child Hospital came to us pretty much a year ago and asked us to make an application based on our current product where maybe we could help them out with fixing this issue. And now this product is ready. It's actually starting anytime soon, any day soon actually, at Karolinska, and they are trained and ready to receive patients on it. So, the idea was to digitize the problem, digitize the manual handwritten labor, try to at the same time streamline the workflow at the hospital, and support the care process in a better way, releasing time and energy for what's really important, caring for the kids. Data has now become more accessible and secure. It's automatically transferred, and it's available in an asynchronic way instead of a synchronic paper that needs to be traveling around physically. And just sort of a sketch over how this works. You have the healthcare personnel on the right. They have a mobile app we are going to take a look at. They also have their web service on a regular computer. But on the family side, the entire family can have an app seeing the same thing, communicating over the apps, between the apps with push notes. You have the kid, of course, in the center, Simon in this case, and all the other support personnel that supports him. And this is how it looks. You have the children app there. This is customized or personalized. You can put your own pictures in there, your favorite hockey player in this case. If you like, take photos of yourself. It contains a picture-based food database where it's sizing food content or plate size or servings is much easier. You don't have to search for it. You can actually click on pictures that represents different sizes of your spaghetti and Swedish meatballs, of course. You also have, as I said, the mobile side on the clinical side, which is an app based on a mini iPad that you basically stick in your scrub pocket. Here you have your entire system in your hand wherever you go. So this is extremely mobile. You can pull up any kid that is currently in the ward, but you can also easily search and pull up kids that have left the hospital and that you service at home when they call back in for support. And finally, then you have the sort of administrative page where you can do some analysis. You can see long-term trends, and you can now also set alerts and notifications based on various types of trending or incidents reporting. So you can actually ask the system on an individual base to do a lot of monitoring for you. So you can react on time when things go wrong before even anybody noticed that. So the app in use at the hospital right now. starting up. This place is relatively large. It's the biggest we have in Sweden. We have about 40 personnel in that clinic, caring for about 700 of the 7,000 in Sweden in terms of patients. It's going to start out right now, and it will grow very fast. We also are pleased with the fact that a lot of other counties and hospitals in Sweden have shown a great interest in this, and we're going to roll out this relatively rapidly here during the coming month. So expansion here is imminent, and we love the attraction that we have received for this product. But it's not only that. We have also now secured funding for, thanks to Vinnova and Weilandt, for a study of the health economic impact on the workflows. We will keep tabs on the clinical results as well, parallel to this, but the most important thing here is to create proof that we can use to tell the story about how you can find effective means of gradually changing your workflow and also a little bit of your care process in this case. But it's also important to study how the patient safety and the data security is actually improving the quality of care given. And we will also study how this affects the daily life of the patient and the family. The results from this are planned to show up somewhere in the Q1 next year, actually. And Karolinska Institute and Astrid Lindgren Hospital will share these data as they come along. So this is my last slide, actually, and I must really want to emphasize on the fact that this is the first rollout of a true digital disease management system in Sweden for diabetes. It's also important to note that for the family and certainly the kid to early enough control your control of blood glucose and get it under control is very, very important and vital for the progression of your disease over the years and to avoid costly complications later in life. With this app system or disease management system, everyone now knows more, and data is available in your pocket instantly, live, directly where you are. It has simply made everything simple for everyone, and there are great gains also on the economical side to be had here. So, with that, I'm done, and that was the case. Thank you very much.
Thank you, Anders. Have a seat.